12 early signs your liver is in trouble. Most people ignore number 5. If you're over 50, you've probably said this a lot. That's just age. About a new bruise, a strange itch, that heavy tiredness that wasn't there a few years ago. But what if some of those just getting older changes are actually early signs of liver problems? Your liver works for you every single day. It filters your blood, helps digest food, processes many medications, and protects you from toxins, quietly in the background. The danger with liver disease is that when the liver starts to struggle or move toward liver failure, it usually doesn't cause sharp pain. It whispers through small, odd symptoms all over your body. Today, on Senior Guide, we'll gently walk through 12 early, strange signs that can be linked with liver damage, liver disease, or fatty liver. Each sign by itself does not mean you have liver disease, but when you see a pattern, your body may be saying, "Please, don't ignore me. And I truly want you to stay with me until the end, because sign number 5 is the one most people ignore every day, and it can be one of the most serious signs of liver trouble." Before we begin, a warm welcome from Senior Guide. If you care about staying independent, informed, and respected as you age, please subscribe to Senior Guide now and tap the notification bell. We create calm, senior-friendly videos to help you understand your liver health and overall health without fear or confusion. Let's start at sign number 12 and count down to that crucial sign number 5. Your body may be saying, "Please, don't ignore me. And I truly want you to stay with me until the end, because sign number 5 is the one most people ignore every day, and it can be one of the most serious signs of liver trouble. Before we begin, a warm welcome from Senior Guide. If you care about staying independent, informed, and respected as you age, please subscribe to Senior Guide now and tap the notification bell. We create calm, senior-friendly videos to help you understand your liver health and overall health without fear or confusion. Let's start at sign number 12 and count down to that crucial sign number 5. Sign number 12, deep, nagging itch with no clear rash. Liver-related itching is a common symptom of liver disease. It often feels deep, like it's under the skin. Worse at night on arms, legs, back, or even palms and soles, with no obvious rash, just scratch marks. When the liver or bile ducts aren't working well, certain substances can build up in the blood and irritate the skin. Dry skin and allergies are more common causes, but if the itch is new, ongoing, and unexplained, especially with other liver signs, tell your doctor. Sign number 11, tiny spider, veins on face or chest. Look at your upper chest, shoulders, or face in good light. Some people with chronic liver disease develop small, red spots with fine lines spreading out, like tiny spiders. A few can be normal with age or sun, but if they're increasing in number, mainly on the upper body, and you have other liver symptoms, it's one more quiet clue of possible liver damage. Sign number 10. Red, warm palms. Your hands can show signs of liver problems. Some people with long-term liver issues develop reddish, sometimes warm areas on the palms, especially near the base of the thumb and little finger. This may be related to hormone changes when the liver doesn't clear hormones as well. Red palms alone don't prove liver disease, but new persistent redness in both palms, plus other signs, is worth mentioning. Sign number 9. Heavy fatigue that feels different. We all know normal tiredness. Liver fatigue often feels heavier, deep dragging feeling. Everyday tasks suddenly feel hard. Sleep doesn't refresh you. When the liver struggles, waste products and energy handling can be affected. Many things cause fatigue, but if this is new, lasting weeks, and doesn't match your activity, it could be an early liver disease symptom. Sign number 8. Brain fog or mood changes. Liver problems can quietly affect the brain. You may notice feeling more foggy, slower thinking or word finding, trouble focusing, more irritability or low mood. Medicines, sleep, and many conditions can also do this. But if your brain feels different than a year or two ago, and you also have other liver warning signs, please tell your doctor. Sudden or severe confusion is always an emergency. Sign number 7. Swollen ankles or lower legs. By the end of the day, do you see deeper sock marks, Puffy ankles? Swelling in both legs that improves overnight? In advanced liver disease or liver failure, the liver may make less of a protein that keeps fluid inside blood vessels, causing fluid to leak into the legs and ankles. Heart and kidney issues also cause swelling, but it's important to notice and report this pattern. Sign number 6. Pale, gray, or greasy. Stools or bowel movements can show signs of liver damage. Normally, stool is some shade of brown. That color comes partly from bile made by the liver. If for several days or longer your stools are very light beige, gray, or clay-colored, or greasy, oily, and hard to flush, it may mean bile isn't reaching the intestines properly, which can happen with liver or bile duct problems. Short changes can be from food or infections. Ongoing pale or greasy stool is a "please get this checked" sign. And now we reach sign number 5, the one most people ignore. Sign number 5, dark urine that stays dark. Most important not to ignore. This may be the most dangerous sign to brush off: dark urine. It's normal for urine to be darker in the morning or when you're a bit dehydrated. That usually improves when you drink more. Be concerned if your urine is tea-colored, cola-colored, or very dark amber, staying that way for more than a day or two, and doesn't lighten much, even when you're well hydrated. When the liver can't process certain pigments properly, more of them can spill into the urine and turn it dark. This can be an early symptom of liver disease, liver damage, or blocked bile ducts. Why is this so important? Because liver-related dark urine often appears before yellowing of the eyes or skin. It can be an early, clear warning of serious liver problems. Most people say, "I just need more water," and ignore it. If your urine stays very dark despite good fluids, especially with pale stool or fatigue, please call your doctor soon. You are not overreacting. You may be preventing liver failure. Sign number 4, dull pressure. Under the right ribs. Your liver rests under the right rib cage. If it's enlarged or irritated from liver disease, you may feel a dull ache or pressure, a sense of fullness after meals, discomfort lying on the right side. Other organs in that area can cause similar pain, but if this feeling keeps returning over weeks, write it down and describe it clearly to your provider. Sign number 3, frequent nausea or OFF. Stomach-liver problems can cause ongoing mild nausea. It might look like frequent queasiness, worse in the morning or after rich meals, not tied to obvious bad food. When the liver struggles with bile and digestion, your stomach can feel unsettled much of the time. Ulcers, reflux, and infections also cause this. The concern is a new, persistent pattern, especially with other liver symptoms. Sign number 2, unplanned weight loss or muscle thinning. Unplanned weight loss in older adults can be a warning sign of chronic liver disease. You may notice looser clothes without trying, thinner arms, legs, or shoulders, a more hollow face, even if the belly still seems full. The liver helps manage nutrients and energy. If it's not working well, your body may start using muscle for fuel. Any noticeable, unintentional weight loss deserves a checkup. Sign number 1, yellowing of eyes or skin. Finally, a classic sign of serious liver disease, jaundice. You may see yellow in the white of the eye in natural light, a yellowish tone to face or hands. This happens when a yellow pigment builds up in the blood because the liver can't process it properly. Yellowing, especially with dark urine, pale stool, fever, or feeling very unwell, is a go-now sign, not one to watch for weeks. If you recognized these liver symptoms, each sign we talked about can have other causes besides liver disease, but if you see a pattern, dark urine that stays dark, new swelling, pale stools, unusual fatigue, your body is giving you early warning. Here's how to respond. Write your symptoms down. When they started, how often, what makes them better or worse. Bring your notes to your doctor. For example, I've had very dark urine for several days, lighter stool, and more fatigue. I'm worried about liver problems. Could we check my liver? Ask about basic tests, blood work, liver panel, and any imaging they recommend. You're not being a burden. You're taking care of your liver health and your future. If this video from Senior Guide helped you feel more informed and less alone, please subscribe to Senior Guide so you don't miss future videos on liver-friendly foods, fatty liver, safer medications, and better doctor conversations. Thank you for spending this time with us. Your health is more than lab numbers.